I'm going to take a slightly different position as I talk, which is really about, I've been really thinking about nursing deeply over the last few months. And, you know, I was just thinking that I've been around 35 years in the profession. God's truth, that's a long time. And nursing's never been so much in the spotlight. We've had times when we've had shortages of nurses, we've had stories, but actually it's really there. Some for the right reasons, some for the wrong reasons. And the really interesting thing is that everybody's got a view on what they think they need to do and what we need to do around nursing. Some of it makes sense, some of it, the most polite thing I can say is it lacks an evidence base. But come what may, there's something that we have to think about and things that we have to do differently moving on. So I decided that I'd call my presentation the Pinnacle or the Precipice. And I'm a bit of a glass half full girl, so for me I'm trying to think of it in terms of, Cheryl, sorry, glass half, okay, glass is always full, sorry. I'll get you back. You know, I've got to believe as a professional and somebody that is absolutely passionate about nursing and what we can do to improve patient care, that I have to believe we use this time for us to be on a pinnacle and to think about what we need to do moving forward. Now, you know, I could talk to you, and you heard some of the stuff from Lisa about we've got to think about values-based recruitment, all the stuff that's in Francis. But I thought I'd reflect on my 35 years and think about the things that I saw, the things that I've heard, the stars that I've met on my career route. Some of them were sitting here, but not so much now. I worked with Cheryl when she was, in fact, I employed her as a sister in Derby, so many moons ago. You know, some of the things that I've seen, the stars that I've seen around, and some, but also just some of my observations of what I think's going on. So it's a kind of different perspective, and hope you'll find it useful. So I go back to my career at the start, a very long time ago. I really tried to find one with Cheryl on, but I couldn't. So that's my sister, by the way. She's a nurse as well. And I think the first thing I've got to say for all those folk that think, you know, how hard is it to do this? Nursing has changed. You know, when they go, fundamental care hasn't changed. Well, of course it hasn't. But what we have to do and how we have to do it has drastically changed. I was thinking not long before I became a nurse, I got appendicitis and had to have my appendix out. I got sent to convalesce for 4 days and got sleeping pills. It's marvellous. But it's like, and actually, when I was first on a ward, the sick patients were the ones round the nurses' station, and there'd be 3 or 4. And in an afternoon, in the empty bed, you'd sit on the bed and talk to the patients. So anybody that thinks we're trying to deliver care in the same environment is sadly deluded. And for some of those people that are saying that, they need to be out there looking at what's going on. So the context, the busyness, the acuity is so much different. And it's like, part of what we've got to do as leaders and nurses at the moment is to get some of that message out there and be able to talk about the story about what nursing is like now and be able to place it in the context and describe it in a sensitive and meaningful way. What's the 10 things then, as we move forward, that I think I would share with you? So, I did it 10 to 1 rather than 1 to 10, just because it just sounded better. So the first thing, it's really, really easy when you're sucked into your day-to-day life to kind of lose sight of what's going on. And one of the pieces of work that I did at the Department of Health was to help around the elimination of mixed-sex accommodation. And I spent the first couple of months arguing with some quite senior nurse leaders about why it was impossible. And I actually kind of got to the point where I thought, hang on a minute, just when did we start to think mixing, putting a vulnerable, frail little old lady in a bay with 3 blokes, or vice versa, was okay? And I was minded that I was talking to Bruce Keogh about it, and he said that when he'd come over from Africa to work in England, and he was horrified to find that patients were mixed because they weren't in Africa. But he said in 3 months he'd got used to it. And that's one of the things about we normalise stuff. There's all evidence around that. And one of the things around when we start thinking about what we need to do moving forward is to challenge our own assumptions and have a look at what I'd call kind of the everyday thing that's going on. And is what you think's going on actually going on, or has it changed? And that mixing for me was, it's like, do you really want to argue with me that this is a bad thing to do? That you can't do it because of demand and capacity. Now, I don't underestimate the challenges that we had to go through, but it's like, do we really as nurses want to argue that? And I think some of the other quality stuff is the same, you know. So first, I think we've got to be really aware of this normalisation. And if that means things like it's really interesting about normalisation. I did a whole peer review process around pressure ulcers in the Midlands and East. And I trained some people to go on peer reviews. And what was really interesting about looking for what we should be seeing when we did the reviews, you would take some of the folk from, say, Trust X, and they'd go and peer review in Trust Y. And they would go, well, that's not right, that's not right. Then you'd go to their trust, and those people from there would be saying the same about there, because they'd kind of normalised it. Or even during the process of doing the peer review, would go, bloody hell, that's happening in my place. But you know, so you can't underestimate the importance of getting time and having processes to think about that. So that's the first thing. Technology's getting me. I've gone the wrong way. Right, so this is the second bit, which is lift your head up. I couldn't find very good pictures, but I thought they would do. And what do I mean by that? What I've observed, one of the other things that some of you will know, but not everybody will know, is during the course of my work, I've probably been into, I did a count, over 70 trusts in this country, health economies and communities. So I guess you say my sample size is highly reflective, you know, representative, and you know, if I wrote it up, probably would have a decent p-value. But one of the things that I notice when I go towards, often when they're challenged or clinical areas, is people's heads are down. And they're kind of rushing, you know, they're going, right, it's the drug round. And I've got to do my drug round. Or I'm now caring for this patient, I've got to do all this stuff. And in the meantime, things are going on around that people almost like, they don't hear bells, or there's people looking for assistance. And I don't often think that nurses are like going, oh, well, there's somebody at the desk, I'm going to ignore them. They're just really focused on what's going on and what they've got to do at that time. And I went to awards that, in not this part of the country, where there'd been a difficult CQC review, and the chief exec asked me to have a look at this particular ward. And the staffing was fine, you know, they'd actually put extra staffing in, they'd changed the leadership. There was lots of things that had been put in, but everybody's heads were still down. So I went on this ward, you know, that we knew it was under scrutiny, knew I was coming, people were just busy, off doing the drugs round. The environment was probably one of the worst environments I've ever seen. You know, it was sparse, it was awful. God, you know, it was just, I actually found it quite distressing to go there. You know, patients just didn't look, they weren't badly cared for, but they just didn't look right. And the bells were going and the buzzer was going and it never changed. And there was lots of staff on that ward. So actually, there was something for me about, in fact, I talked to the leaders about how do you help your teams lift their head up and look around at what's going on. It's a bit like the normalisation, but it is a very specific, let's just check what's happening in our place today, and is really connected to that. Oh, I don't know why that. The next thing that I think is really important is I will tell you that for every problem you've got, somebody has sorted it somewhere. And we're really, really bad at not checking out what's going on elsewhere. The number of people that have set up use pressure ulcers, I've never seen so many forms designed for a bundle for pressure ulcer prevention across the country. You go on the website, there's loads. But people are spending hours sitting designing them. And then they're all arguing because they go, it's different, we're different here. Trust me, you're not. And actually, the ones that people that I see are doing, really thinking differently, do look and see what's going on elsewhere. And they nick. They plagiarise proudly. And that's what we need to do, because actually we can save ourselves hours and hours and hours and hours if we start with, not the blank sheet of paper, but something that's 90% done that we can then tinker to meet our own local needs. So kind of, looking up and out is a really, really important trait. And you will see that, some of the really strong leaders that I've seen around, almost like their starting point is who can help us, who can give us new ideas, and how can we do things differently, and can we borrow stuff, I really wasn't going to mention her name, seeing as she was rude about it. But if you look at Wolverhampton and think about, they were one of our really early HCI programs, really, really not great position with MRSA, well, second or third worst in the country. They're now probably the best in the country. How long? 3.5 years without an MRSA bacteremia. It's just stunning. But one of the things about that is being prepared to seek help, look for new ideas, act on them, good leadership. Well, it's not bad. But looking up and out is really important. The other thing that I've really discovered recently as well, which is understanding how you can access and use things like social media to help you look up and out. I've become a tweeter. And actually, the things that I've got off tweets, I mean, I don't tweet loads, I tweet a bit, but actually I'm more of a lurker. That's the other name of those of you that don't tweet. Because actually, people put amazing articles, great pictures. You read absolutely up to the minute info, articles, people, from really high-profile people that you'd never get access to, that suddenly put a really interesting article onto the tweet for you to pull down. It's amazing, and it's like I've become a total convert. I'm encouraging everybody else to become a convert, even if you don't tweet. God, it's amazing in terms of your look out. How many of you tweet? How many of you got an account? Yeah, I knew you wouldn't know. So there's something about doing more of that as we move forward. This other one is a really biggie for us as professionals. Everywhere I go, there's this whole bit of they said, and I'm really often not sure who they are. And when you actually start to talk to people, particularly nurses, about who they are, they're actually not sure either. So one of the biggies for me is to do with nursing documentation. It's like, if I can get to the end of a career and we've reviewed documentation, I'll feel so happy. But it's like every time I've done reviews, I'll go and say, they'll say, well, they said we've got to have this documentation. They said we've got to have it this way. They said, and it's like, are you really sure that if you talk to your nurse director, she's saying it's okay that you've got to sign your name 35 times? Which is one of the documentation I saw. I know it's probably not uncommon around the country. And there's all this sort of, I call it the muddle in the middle, which is you get leaders with really, really great vision, know what they want to do, frontline staff just, and then in the middle there's all this sort of assumption and almost like myths about what people can and can't do. And people, I think, are actually immobilised by the myths of what they're allowed to and not allowed to do. And so there's something for me in our work as nurses to go, actually, if something's a really silly idea like signing your name 35 times, why can't, what's stopping people going, that just doesn't make sense. Let's talk about, as opposed to, we're not allowed to, or they said we can't. So it's certainly the nurse leaders, but those of you that are in practice now, just kind of going, what's the nonsense and who are they? And so for when you find yourself going, well, we can't do that because they said so. I had a really simple example for myself in my own organisation. You know, I'm new into it. And I got an email the other day and it said, please can you approve the purchase of a new computer for a new member of staff who is going to need a computer every day. So I said, why are you asking me? I'm the managing director to approve. Actually, we've got it in stock. They only had to put it in. It wasn't even buying it. To give Michelle her computer when she starts on Monday. Well, you have to approve it. I'm like going, no, I don't. It's like, why can't our line manager approve it? And she went, well, she's on secondment. What? She's on secondment for a year and she's in charge. And actually, they said that it had to be the MD. And actually, it was old historic behaviour that had perpetuated, and it was a nonsense. Suffice to say, we're changing that. But it's just, you know, if you find yourself saying it, challenge it. This is probably at the heart of what I want to say as a nurse, which for me over the years, I think my ability to become more compassionate and care more deeply was the kind of realisation that sometimes you have to connect on a personal level. And, you know, when we're really, really busy and we're thinking about how to handle our patients, that we really just think what it feels like for them. You know, this is my mum. In her better days, my mum's got a terminal illness, and I've just been caring for her for a week. And I was putting her to bed, helping her to bed. She's still mobile, but you know, it's like she's got pulmonary fibrosis and it's in her late stages. But it's like I was helping her undress, and she was like a bag of bones. And every time I touched her, it hurt. And I took her specs off and asked her to look at something, and then she realised, she said, oh, I can't see that close up. Then I took her hearing aid out, and she couldn't hear me. And it was just like, oh my God. That's the bit around, you know, most of the patients sitting in our beds are like my mum. And the way I handled her, how I talked to her, it was really, it's quite challenging for me at the moment, but it's just like, that's where we've got to connect. If we've got to get our new nurses, ourselves, to kind of keep that connection. It makes it, I think, possibly tougher to do the job. But that personal connection for me is just so important. And, yeah. I also think it's really, really important that whatever job you do in our profession, whether you're in teaching, whether you're like in me as a managing director, whatever role, you keep connected to patients and your frontline staff. If anybody's sitting here saying, when I was a ward sister, as I talked to you at the start, you're missing out. You're missing out on an ability to be able to empathise with the staff that are going through training, that are supervising, and most importantly, you're missing out on listening to patients. In fact, at the minute, I'm just, even in my national jobs, I was on a ward regularly. And you know, able to talk to frontline staff and patients. I haven't done it for a bit, so I'm actually talking to one of the local trusts about doing just one shift once a month, just to kind of remember why I came in to do the job, lest I ever forget. But I think, you know, we've got to connect because the world changes at such a pace. I think part of our career and our challenge is to remember that we've always got more to learn, and that might not be just about what education programs we've got, but it is, you know, it is about what you read on Twitter or what articles you read. God, I just found an amazing article. I didn't realise that sugar could stop the spread of MRSA. Bloody hell, if I'd known that's in 2005, you'd have saved all those bags of sugar instead of all those new mattresses, Gerald. So, but there is always something to learn, and I think there's two things I want to say about that, which is about what you learn academically and skills-wise, but what you learn about yourself. And I think our profession needs a lot of reflection. We need to be constantly thinking about how can I do this better? Am I behaving in the right way? You know, the whole thing about recruiting for values is only good as long as we keep having those values and those behaviours. And we know from Francis it wasn't about the new students. It was about people that had been there a long time. So actually, we have to constantly reflect and think about how we do that. Whatever role you're in, you are a leader of some sort. And I hear people, well, I'm not in charge of anything. You know, if you're a staff nurse, if you're maybe supervising a healthcare assistant, student nurses. So there's something around, as professionals, thinking about our leadership role right from the start. As a student nurse, you will be quite possibly working with somebody that knows even less than you do at this point in your career, but you will lead in some way. So there's something about understanding leadership, the latest information on leadership, so that actually you're equipping yourself for whatever level you're at. And again, you don't have to do leadership training, although it's very nice to do that. You can read about how you become a better leader. I think this is my biggie, well, another biggie really. We know from experience that people can have, you can go in an area and it is like you have the life force sucked out of you. I think it's really important in the cultures that you as leaders, ward leaders, team leaders are trying to create, that actually you've got to beware the Dementors and actually think about how to manage that. Because all the effort that you can put in to try and help create a new culture is totally lost if there's some Dementor sucking the lifeblood out of everything you're saying. You know who I'm talking about. And so there is something, about what do we do about that? And it's almost like if we ignore it, if we ignore the people that don't exhibit the behaviours, that haven't got the right attitude. Oh, Cheryl doesn't know about Harry Potter, sorry. Okay, sorry. Okay. Dementors are in Harry Potter. And they're the people that suck your life force out of you. So, that was a spell. It gets the Dementors away. Yeah, they're good. So there's something about, on our journey, about A, recognising your Dementors, and they can lurk in all sorts of places and crevices. But B, actually doing something about them and challenging some of that behaviour, because it will sap the culture that you're trying to create. I've just taken over Health Education West Midlands, which has got about 140 people. There are some Dementors, and we're working on them. So, it's really important if you're trying to get there. And then the last bit I just want to say that really worries me greatly. You'll know some of those. Is this bit about, I know it's really, really, really busy. I know the pressures are relentless. But I do think a big part of our challenge is we have lost our ability to have some of the fun. And it's like, I was just thinking, that poor chief exec in Hull, Phil Morley. Now, I'm not necessarily saying that I thought it was a great outfit when he was dressed up as Superman and it ended up on YouTube. But for God's sake, he was trying to put a bit of humour into something that had a really important message. And what did we do? It made the bloody news. So there is something about how can the leaders, and that's, at whatever level, even have 5 minutes in a day to remember the joy that actually, and the pleasure that some of our, a big chunk of our job gives us. It's like some of it is a slog, some of it's hard. We know it's hard to constantly be positive when you're caring for people day in, day out, and it's really, really relentless. But, we've got to try and get a little bit of that back. And I don't know how yet you do it, but, thinking about shifts and, we lost a lot with handovers. There's all sorts of things, but there's something about what do you do to put a bit of fun back into some of the way that we operate now, and how can we do that and not quite end up on YouTube. But I think it's important. And again, where I see organisations that I've got some really great nursing leaders and some great nursing practice, they have found ways to both reward folk, celebrate success, have a little bit of fun. The ones that I've been in that are really struggling are just soulless and hard work, really. So for me, that's having a bit of fun at the end of the day. Well, you know, the evidence says it's quite a good thing to do. So that's probably, so that's my 10 to 1 things, that I think are really, really important. Now, you know, I've tried to do it with a little bit of humour, but there's a really serious message about those. Those are things that absolutely are important if we're to consider how we make sure we actually are on the pinnacle and not on the precipice. I remain optimistic. I don't think we've ever had a better opportunity. Out of the adversity, we have opportunity. We would be mad if we didn't seize it, but we've got to be really clear about what we're going to do. And as professionals, we've got to be together in the messages that we come out with. And that way we'll be on a pinnacle. So, thank you.